Africa, let us talk about health and medicine. Health care, medicine. Let's talk about that. We go to the hospitals or to the pharmacy to buy off the shelf items or even pharmacy to pick up prescriptions. We do. Africa, what do you think about your health? Your health and your well being. What do you think about it? That's a question I'm asking you. What do you think? Africa, what do you think about your health and well being? You know, we Africans get involved in every area of human endeavor. And when we pursue those endeavors, we do well in all of them. After doing well in all those endeavors, the next thing is to relax. But without paying much attention, we have lost some grounds in some areas. So that's why we are talking today about health care and medicine, healing, curing, caring, attending to health needs. So Africa has to pay close attention because we go to receive care and we get prescriptions. We buy the things that have been prescribed. We use them, but we cannot pretend that those medicines, we cannot pretend. I'm looking for the best way to put it. Most of the time, if not all of the time, medicines have side effects. Yes, they do. They have side effects. So when you, as an African, take medicine, what are you trying to kill? There are some ailments that need high level, sophisticated, and scientific, arrangements. They are in existence. But it's not just every ailment that an African should run to the pharmacy to go and buy prescription medicine or off the shelf generic drugs. Think first. You have shrubs, you have leaves, you have barks, you have roots. You do. So when you think about the roots, the barks, the shrubs, the well, there's so many of them. Roots, barks, shrubs, fruits. Your ancestors, our ancestors knew which fruit did what. They knew it. And they told us about them. They told us. But you know one thing we did not do? We did not grab a pen and paper to write those things down. When I say we, I just mean on the most part. Because there are individuals also among us who took time to capture those solutions. And that's why we're even able to get some of them right now. But if we had made it a point of duty to record, capture, document those ailments and their solutions, I believe that life would have been better. That's what I believe. Life would have been better. So many of us wallow in ignorance because know, we do not know the solutions to some of these ailments. So we run to the pharmacy, we run to the drugstore and buy. There are so many popular generic drugs that, okay, I have a headache. Let me go for Tylenol. Let me go for, what do you call it, ibuprofen. Let me go to all those. There's so many of them, popular, well known. Do you think about the side effects? Do you think about what you are trying to solve and potential hazards you can bring on yourself? Do you think about that? Now, does your doctor, your medical practitioner, your physician, does he or she know about your roots, barks, leaves, fruits as solutions? Does she? Does he? So, but if you tamper with your health by just running after medicines, well, that's your choice. I have no problem with medicines, but I know that there's a place for everything. In other words, everything has its place. So, if something is a nagging problem that requires scientific involvement, requires mechanical process, requires all those other kinds of things and tools, then we understand. But if it's about your stomach ache, your headache, your hand is hurting, your ankle, even your skin, maybe you have a rash, all those things have solutions right around the corner, right behind your house, right in front of your building, right on the soil, right on the grass, right in the field, right around the place. You can find those solutions. But don't think about it. Once you have that little um, problem, of course, don't get me wrong, no health problem is little. I just use little just to say the moment you feel something going on with your head or your hand or your back, you run to the drugstore to buy medicines that you don't even know what their side effects are. That is what we want to address today. Do you know about those leaves? Do you know about those barks? Do you know about those shrubs? They have names. They do have names. So, what you want to do is to approach the elderly people in your community, in your hamlet, in your village. Approach them and ask them, what is the name given to this? And what does this do? What does that fruit do? What does this leaf do? There's so many of them. And to even make it worse, we will go and search to find out what someone else will tell us, what others will tell us about what's happening to us. When we already have solutions that we can at least begin from point A to point B, is it in mathematics? Yes, it's in mathematics. We were taught to go from the known to the unknown. So the same thing applies everywhere. In every area of human endeavor, going from the known to the unknown is a standard practice, standard process, standard procedure. So when a problem comes up, you have to ask yourself, what do I already know? Dig down into your arsenal, into your mental archives, into your into your reservatory. Find out. You have something you already know. Go there first, and then when you confirm the things you already know, you will begin to find the gaps in knowledge for you. You will then begin to find ways to plug those gaps. But when it comes to medicines, to your health, to caring for yourself and your loved ones, your family members, when it comes to that, you will know that the, the solutions you already have cannot be overemphasized. We cannot even demean them either. You have solutions. Think about them because health is wealth. You can have all the money in the world, but you don't have good health. Health issues can drown you and drain you and destroy you, damage you because you don't have the knowledge. Knowledge, they say, is power. So go from the known to the unknown. What do you know? What knowledge do you have regarding the health issue you're looking at? It might not even be you who is sick. It might be a relative, a child, a sibling, a parent, an uncle, an aunt, cousin, somebody not to even somebody in your hometown who is not related to you might be the one who is sick. What do you know? So you can begin from there. What knowledge do you possess that you can use to the benefit of that person? Knowing that you do not want to cause a damage while trying to solve a problem. Don't cause a damage. If you know that a medication can cause new problems, then you will not pursue that medication. You want to pursue solutions from the known to the unknown. What knowledge gaps do you want to plug? Again, medicines, healthcare, Africans, you have everything it takes to find immediate solutions, not just to rely on a third party or a second party or another authority. When it comes to you and you have solutions right under your nose, right under your feet, right around your corner, but you do not think about it because you've been made to understand that once you're sick, doctor. Yes, of course, you need to talk to a doctor, but the doctor you're talking about, does he or she understand your health paradigm? I mean, traditionally, culturally, societal norms, societal solutions. Does that your doctor know what is available to you? You have to have solutions. You have to have solutions. I mean, you have to know what those solutions are. What we're talking about today is that medicines a lot of times have side effects. You do not want to use medicines that will solve that immediate need and create another short term, medium term, or long term problem. You begin to deal with that. Then, when you look for medicine for that new problem, that medicine will cure that new problem and create a new problem that you have to. So, you then be on a trail. It's called a trail. You're on a trail. Health trail. If you're going from one station, headaches from headache station to ear station, from that to nose station, from that to throat station, from there to forehead station. You go from station to station because each medicine that treats a problem that you presented gives you another problem to solve. And you know what? You are hurting yourself the more. If you are an African, tell yourself that first of all, you have a solution, but you do not know what that solution is. Look around, find a relative, find somebody, an elder in your community, find your father, your mother, your uncle, your older brothers, and your older sisters, people in your area, people around you. Tell them what that problem is. They will tell you, oh, yes, there's this leaf in your uncle's compound. Yeah, the other friend of mine used it last week and he's okay. But if you did not do that, you run to a physician, fill out the form, pay for the card, sit down in the lobby, wait for your turn, and you get called in, and then you'll be intimidated by the white robe, whatever they call it. You say white robe with the stethoscope, on the neck and all that. You are already intimidated, and whatsoever you are told, that's what you will do. Meanwhile, you passed in front of the leaf or the bark or the fruit right in your compound before you even got to the bus stop to go and take a taxi or bus or something to go to the doctor. So the thing is that we have to begin to go from the known to the unknown. You have solution already. If you are African, you have solution already. All right, let me just look at another chapter of this topic. Decisions regarding health come from policies that are made by some people. There are policymakers everywhere. You know that there are policymakers. They make the policies, and those policies are followed by the physicians and by the pharmacists, by the manufacturers. The policies, decide those things. Now, when you fall sick, you will go to get solutions based on the policies that have been made. And so sometimes the policies are local, sometimes the policies are international. So if you are not careful, you just keep following policies and obeying the rules and doing everything you have been told. And meanwhile, you are hurting yourself more and more. Why? Because you do not know that as an African, you have a solution that you can even sell to non-Africans. Now, when it comes to policies, we know that there's a place called World Health Organization. Very, very popular. Very popular. World Health Organization. Everybody knows World Health Organization. We all know that place. We ask them, how do we do under XYZ circumstances? What do we do? They'll say, do this, do that. They even create something they call protocol. Now, the protocol, how many countries do we have in this world? Now, the World Health Organization will create a protocol, and then you will follow it even in the remotest parts of the world, including that little unknown village in Africa. WHO protocols. Again, I do not have any problem with all those protocols and all those things, but the thing is, you must go from the known to the unknown. What do you already know? What knowledge do you possess? So when a problem arises, do you now run to the World Health Organization to find solution? Okay, hold on one moment. Hold on one moment. I've already mentioned World Health Organization. I've mentioned that. And if you are African, it's possible that you may never have heard about African Scholars Health Organization, ASHO. African Scholars Health Organization. These are scholars. And who is a scholar? Scholar is somebody who has gathered knowledge, studied something, and gone scientific about it, and can talk about it with authority. That's who is a scholar. So now a group of African scholars have their health organization. So if you are African and there's a health problem and you need to know policies, and you are in one of the remotest villages in Africa, whose policies would you like to follow? Is it the policy of the person in a faraway country that you have never been to, you may never have heard about it, you just know that there are policies? But I am telling you that as an African, you have to go from the known to the unknown, and the known is the fruit you already have, the leaves you already take, the box you already use, the roots you already know. Don't look down on them because they are made for the healing of the nations. That's the way. For the healing of the nations. So that's what they are made for. So now, if it's made for the healing of the nations, so you want to say, okay, it's made for the healing of nations in Asia, nations in Europe, nations where? No, the nations. You are the nations. It's made for the healing of the nations. So begin from yourself. You are the nations. Find out what those roots made for the healing of the nations. Find out what they are. The barks made for the healing of the nations. Find out what they are. The leaves made for the healing of the nations. Find out what they are. Ask questions. Find out. Go to an elder. Pick up that leaf or that fruit or that. Ask the elder, what is the name of this fruit? What is the name of this leaf? What is the name of this bark? How can this be used? What would this be used for? And when they tell you, don't just hear it and walk away. And when you die, no one else gets the information. Pick up your pen and paper and write it down and share that information with someone else who can also read it. Medicines, healthcare, Africans, you have solutions. Think about your solutions. Go from the known to the unknown. Go and look for the African Scholars Health Organization if you're looking for policies, because that body has a policy council where the individuals on those policy seats, those councils, they are individuals who are from remote villages across Africa like you. They're from different countries. So their health policy council is made up of people like you and me. So if one person does not know a solution, the other one knows a solution. So that we can domesticate, if you like that word, all right? Domesticate the solutions, all right? Localize the solutions so that we will not be creating new ailment because we are trying to solve an ailment. We want to solve an ailment without creating additional problems. That's what we're trying to do. I'm sure you know what I'm talking about. This is an what do you call it? This is not debatable. This is not debatable. The principle of going from the known to the unknown cannot be debated. So begin from there. From the known, you have headache. Don't just rush off to the drugstore to buy headache drug. No, it might just be water that your body needs. It might be that water that contains a bark in it that your body needs. It might be water that contains a leaf. It might be warm water, just plain warm water. It may be warm water that contains a root. So you have to begin from the known to the unknown. And when you exhaust all the known, then you begin to go into the unknown, which is for you an uncharted territory. At that time, you begin to seek solutions from the outside. And if there is a physician who is in your village, in your local area, in your hamlet, a physician, don't rush off and go to look for a physician that you don't know anyway. We've already been told that people are not even so much, acknowledged where they come from. And of course, I believe that statement. I believe it. I really believe it. All right. So, but don't get caught up in that mindset of not recognizing and using something that is in your hamlet. Don't be caught up in that. If you have solutions in your hamlet, use them. That is also part of going from the known to the unknown. World Health Organization is very popular, WHO. I respect WHO so seriously. All right? I respect WHO. But WHO is not going to be everything. It cannot be everything. It will have its own place in the scheme of things. Your fruits, your leaves, your barks, your roots will have their own places in the scheme of things. So don't hurt yourself by looking for solutions in the wrong places and then causing yourself untold harm. And when you cause yourself the untold harm, then the harm will come on not just you alone, but it will come on everyone around you. Because in Africa, care is group wise. When one person is sick, the whole family is involved. Everybody is affected. You're not on your own. So when you begin to feel something coming on, you can begin from the known to the unknown. What am I feeling? Talk to somebody. It might just be something that's right in your house. You don't even need to go out. You already have it in your house. Reach out, get it, use it, solve it, free yourself. But when you begin to trust in manufactured medicines, then you can run into anything. I know that for you to have just take one little pill, that pill, as small as it is, might contain the value of 100 oranges. It's possible. That's why they measure those pills in milligrams, 200 milligrams, 500 milligrams, 1000 milligrams. That's what they do. But I mean, if the 1000 milligram will create a problem, then take your time, be licking one orange after the other from your compound, the natural orange, the organic orange that's in your compound, in your village, that has not been injected with um, systems, new scientific systems. So It will also have high efficacy. Take medicines. Don't get me wrong. Go to your physician. Get help. But I'm saying that under some circumstances, you can just go and use what you already have. So policies are important. Somebody is making policies, like I said before. Someone somewhere is making policies that are trickling down. That the governments are using those policies, the physicians are using those policies, the hospitals are using those policies. But if you have to use policies, who should give you the policy you should follow? You should go African too. That is why I remember the group called the African Scholars Health Organization. Look them up. ASHO, African Scholars Health Organization. Find them out. And if you know enough to help other Africans, tell them that you want to join them to be in their organization so that you can participate in making policies that will help Africans enjoy good health. Medicines.